Hello, my name is Paige Jordan, and the disease I chose was heart disease for this course project. What is heart disease? Heart disease is the leading cause of death of people of most ethnicities in the United States. About 610,000 people die of heart disease in the United States each year, which is 1 in every 4 deaths. There are various types of heart diseases, with the most common being cardiovascular disease. Cardiovascular disease is a type of heart disease and is a very common heart disease. Cardiovascular disease can refer to different heart or blood vessel problems. The term is often used to mean damage to your heart or blood vessel by fatty buildup in the arteries. There are many negative effects of having heart disease. Heart disease can have a lot of negative effects on your body, tissues, cells, and organs. The brain can also be affected by being deprived of oxygen, and that can cause brain damage or even death. The tissues of the heart can be affected as well when someone has heart disease. This happens when a blockage is present. The tissues without adequate blood supply will die. The heart is a major organ in your body, and when you have heart disease, it can damage your heart or even kill an individual. Your kidneys can be affected by heart disease as well. To make up changes in your blood flow, your body delivers oxygen-rich blood to the most important organs. These organs are your brain and your heart. This means the kidneys do not receive enough oxygen-rich blood, and with the kidneys not functioning properly, the water in your blood could not be regulated as well. Everything can potentially be affected by having heart disease. Your heart primarily, brain, tissues, and cells. Heart disease also affects the organ systems. The circulatory system is one organ system that is affected. The heart is an essential part to the cardiovascular system because it permits blood to circulate and transport nutrients, oxygen, carbon dioxide, hormones, and blood cells to parts of the body. When someone has heart disease, it affects the circulatory system because if the heart is not functioning properly, which in turn affects the system. If the disease gets severe enough, it can potentially affect all of the organ systems of the body. There are some symptoms of heart disease. Knowing the symptoms of heart disease can potentially save your life. The most common symptoms is anginia, or chest pain. Discomfort, pressure, heaviness, pain in the chest, or below the breastbone can be a symptom of heart attack caused by heart disease. Discomfort radiating to the back, jaw, throat, or arm as well. Fullness, indigestion, or a choking feeling can also be a symptom of heart disease. Sweating, nausea, vomiting, shortness of breath, extreme weakness, and irregular heartbeats. How can you prevent heart disease? There are some preventative measures that you can take to help prevent heart disease. Keeping your heart and arteries as healthy as possible is a major way to help prevent heart disease because that is the cause of heart disease. The primary prevention is the goal is to slow or stop heart disease before an event such as a heart attack or stroke occurs. Secondary prevention is the goal is to prevent a repeat event in a patient who has already had a heart attack, stroke, or another serious cardiovascular problem. Also, lifestyle changes such as incorporating physical activity and eating a heart-healthy diet are essential to prevention. There are some medications that can also be taken to help prevent a heart attack or stroke as well. How can you treat heart disease? CPR can treat a stroke caused by heart disease. CPR can essentially stop a heart attack or stroke when done correctly. Surgery can be performed to treat heart disease as well. Stents can be put in the heart to help prevent a heart attack or stroke. Also, bypass surgery can be used to treat heart disease when your coronary arteries are blocked. The long-term effects of heart disease. The long-term effects depend on many factors, including the type of underlying heart disease, the person's reaction to the medications, and the extent of impairment. The long-term outlook on patients is looking better because of the medications that are now available to them and the treatments that are now available. The short-term effects of heart disease. The short-term effects include chest pain and impairment to the person. The person can be in major discomfort and can be unable to do things that they were once able to do because they now have a heart disease. Not everyone is the same with the effects of heart disease. And these are my references as well. And continued. and thank you for watching my recording.